Welcome to lecture number 1, an introduction to the profession of dentistry. So what makes dentistry different from other professions? Well, here's why. Long-term family relationships are important to the dental team. It's very common for all members of a family, immediate and extended, to visit the same dental office for many, many years. It's far less common for other medical professions to do the same. The dental team also treats symptoms that range anywhere from acute emergencies to huge cosmetic procedures. So what makes up this dental healthcare team? Well, first we have, of course, dentists, but you also have dental hygienists, front office personnel, and back office personnel, which you'll be a part of. So the educational background and requirements of dentists are pre-dental coursework, usually in college, which they obtain a bachelor's degree, and they have to have calculus, physics, chemistry, inorganic chemistry. They also have to take what's called a dental aptitude test, or DAT, to be able to qualify to get into a dental school. They usually will go to a 4-year dental college, and then they take both written and verbal and clinical boards as well. There are several dental specialties that require an additional 2 to 6 years of education after dental school. So these dental specialties, which it is important that you know, is endodontist, or what I like to say, the root canal doctor. So their root canal treatments are performed by endodontist, and the endodontist is primarily concerned with the health of the dental pulp inside the tooth. So when you think endodontist, think root canal. The oral surgeon does what you think, surgery of the mouth and jaw, and it takes an additional 6 years of training to be an oral surgeon. The orthodontist, when I hear orthodontist, I think braces, because they're the doctors that guide and correct misaligned teeth. Pedodontist is the doctor that treats oral conditions in children and adolescents under the age of 18. Periodontist primarily treat and diagnose the diseases of the supporting and surrounding tissues of the teeth, so the gum tissue and bone tissue. Prostodontist is the doctor that restores and replaces missing teeth and oral structures. So it is important to know the difference between the endodontist, root canal doctor, oral surgeon, surgery of the mouth, orthodontist, braces, pedodontist, children, periodontist, the supporting and surrounding tissues and bone around the teeth, and the prostodontist replaces missing teeth. So the dentist's responsibilities are varied, and here's just a couple of them. They correctly diagnose the needs as well as give an overall accurate picture of dental health for the patient. They provide state-of-the-art diagnostic and technical proficiencies that are necessary to treat oral conditions in the mouth and surrounding tissues. And then they give proper instruction for how to prevent disease in the future. Now we move on to what the educational background is of registered dental hygienists. So the licensure of a dental hygienist is usually a minimum of 2 years of academic study at an accredited program. Usually there's 2 to 4 years of a bachelor's degree and then the dental hygiene school. They also must pass a board exam as well. And their responsibilities, but are not limited to, documentation of the health history and missing teeth, existing dental prosthesis and abnormal findings. They also must perform a professional dental debridement, which many people know as a cleaning. They remove stain and plaque and calculus from the crowns and roots of the teeth. They expose and process dental radiographs, which are x-rays. They properly apply sealants and fluoride, and they give preventative care instruction as well as place and remove periodontal dressings. Now we move on to front office personnel. This usually consists of office manager, financial coordinator, and front office assistants. The responsibilities of the front office are as follows. The office schedule must be maintained, and it is one of the most important jobs in running a smooth and efficient dental office. Front office personnel also greet and greet patients and answer the phone in a very friendly and welcoming manner. They check patients in and check patients out in a courteous and efficient manner. They manage accounts payable and accounts receivable. They also present dental treatments and treatment plans, explaining the recommended treatment, the cost of treatment, as well as any dental insurance that may be utilized. So then we move on to the back office personnel responsibilities, and that's where you'll fit in as a dental assistant. Some offices have a sterilization technician, and they're responsible for removing contaminated barriers and materials following dental procedures. They sterilize equipment and instruments and prepare the operatory for the next patient. Not all offices have a sterilization technician as a sole responsibility. Many offices utilize the dental assistants as a sterilization technician as well. Some offices have the next, number 2, the lab technician. But a lab technician is not normally an immediate member of the dental team. Some offices do have a lab technician, which will make crowns and other restorations in the lab portion of a dental office. So now we come to such an important part, the dental assistant or chairside dental assistant. That's you. So they assist the dentist with all dental procedures, and the responsibilities include, but aren't limited to, providing an excellent first impression for the whole dental office, building patient rapport, explaining recommended procedures as well as giving treatment plans to the patients, providing detailed oral hygiene instruction, which means helping patients know how to care for their teeth. They also assist the dentist, as I said, in all phases of dentistry. One day you could be doing fillings and crowns, the next day you could be placing implants and veneers. They also fabricate temporaries, remove sutures, and take excellent dental impressions.